The impact of diabetes on the U.S.-Mexican border region is devastating. The rate of mortality is 50% higher than in the rest of the country, and Hispanics are 2 to 3 times more likely to suffer from serious complications. This elevated prevalence is directly associated with obesity. Self-management behaviors, such as healthy diet, increased physical activity, glucose self-monitoring, and foot checks, are fundamental in avoiding long-term complications. However, for many adults, these behaviors constitute major lifestyle changes for which there has been little professional and family support. Vivir Mejor is an initiative to create a system of care to prevent and treat diabetes in Santa Cruz County. Vivir Mejor is a consortium or coalition of diverse partners working together across sectors to make the healthy choice the easy choice for healthy eating and active living. Vivir Mejor is supported by federal funds from the Health Resources and Services Administration, Office of Rural Health Policy, and the Centers for Disease Prevention and Control REACH program. The initial members of this consortium are Mariposa Community Health Center, Southeast Arizona Area Health Education Center, Nogales Community Food Bank, Carondelet Holy Cross Hospital, Nogales Community Development, and the University of Arizona Prevention Research Center. Here is how Vivir Mejor works. Healthcare providers with patients at risk for diabetes can refer them to Platicamos Salud, the Health and Wellness Department, where a patient navigator enrolls them in diabetes education classes. High-risk criteria include elevated body mass, elevated blood pressure, and elevated A1C levels, and interventions are focused on both prevention of future conditions and management of existing conditions. Class topics include what is diabetes, diabetes and complications, foot care, and counting carbs. The diabetes classes are provided by Mariposa Promotoras, who meet with participants weekly for 8 sessions. A 9th session on financial literacy is provided by Nogales Community Development. In addition, yoga and aerobics classes are also offered. Upon completion of 5 of the 8 education classes, participants can receive a voucher which entitles them to a diabetes-appropriate food box from the Nogales Community Food Bank. Also available are one-to-one nutrition counseling sessions with a certified diabetes educator from Carondelet Holy Cross Hospital. During year 1 of Vivir Mejor, CHEC provided continuing medical education on diabetes medication management for providers, motivational interviewing for physicians, and Diabetes 101 for clinic support staff. Additional partners joined Vivir Mejor to expand the consortium's reach and change norms, the environment, and policies to promote healthy eating and active living. These efforts are supported by the Reach Su Comunidad grant funded by the CDC. The consortium has expanded to include Santa Cruz County, the County Superintendent of Schools, the University of Arizona Cooperative Extension, WIC, Santa Cruz County Adolescent Wellness Network, and Cosechando Bienestar, which sponsors the local farmers market. A total of 59 individuals completed at least 5 out of the 9 diabetes education classes. The average age of participants was 62. Class participants completed pre- and post-tests regarding food consumption, management behaviors, and satisfaction with diabetes control. This table illustrates the percentage of participants who indicated that they were engaging in each of the management behaviors at pre-test and at post-test. All maintenance behaviors had a statistically significant increase from pre to post-test. When participants were asked, how has the program Vivir Mejor changed the way you manage your diabetes? Their responses reflected they felt more confident in controlling and managing their diabetes after taking the diabetes education classes. This chart illustrates the impact of nutrition counseling on A1C levels. Average A1C measurements at the initial consultation were 10.43%. At the first follow-up, 3 months later, the average measurement had decreased to 8.7%. At the conclusion of the first year, we made significant progress towards the Vivir Mejor goals. The diabetes education classes and nutrition counseling sessions increase knowledge and improve diabetes control behaviors. 3 participants were so committed to their new lifestyle, they have trained to become volunteer lay leaders in their community. They will teach others how to prevent and manage diabetes. The Nogales Community Food Bank is yet another point of contact for the Vivir Mejor Consortium to interact with community members to support and encourage healthy eating. Continuing medical education provided by Vivir Mejor partner CHEC helps providers meet patient needs in Santa Cruz County. Physicians who have participated in motivational interviewing, one of the Vivir Mejor training topics, expressed increased ability to foster quality interactions with patients. Mariposa's patient navigators have been monitoring participant progress with the aid of electronic medical records. In subsequent years, the accumulation of data will provide a detailed account of participant health outcomes. Vivir Mejor will continue to reach out to as many people as possible in the community by strengthening existing partnerships and looking for opportunities to grow. Mariposa and partners are looking forward to exciting work